this is the end of the road. Meaning, what does dialysis do to a patient? Just to prolong the life. You're right. So one time, I shared this Putier Placenta to her, and she gladly took it. She said, wala na pong mawawala sa akin kasi wala na akong magagawa sa buhay ko. And then she gladly took it. She took the medications, this time 2 in the morning, 2 in the afternoon, and 2 in the evening. Oh, after about 3 weeks, from a creatinine of 1,900, it went down to 400 plus. We were so happy. She was so happy. She went back to her nephrologist and she said, I am taking something, doctor. And the doctor said, what are you taking? She divulged the name of the food supplement and she said, Putier Placenta. The doctor said, all right, go ahead. Whatever you're taking, you continue doing it. And she said, oh, we are very happy because of that new development. Another patient. For now, actually, the particular patient who is undergoing dialysis has already reduced her dialysis to about once or twice a week. And she's so happy. Another thing, very significant finding was that every time she goes inside that particular room for dialysis, all her classmates also undergoing dialysis, they would always clap when she enters the room. Why? Because they always see a more beautiful patient coming in that door every time she goes inside for the dialysis. There is another patient of mine. This one is quite so difficult to treat. This patient has a neurological deficit, and he was born with it. Right now he's 32 years old, and he is a quadriplegic, being a cerebral palsy patient. Do you know what cerebral palsy patient is? It is a disease, you were born with it. There is a miscommunication between the brain and the other parts of the body. In other words, that particular patient cannot take hold of anything. He would just look at the ceiling and then do like that. With hands, you flex like this, always like this. He came to me because not of the cerebral palsy, but because of cough. And that particular cough he was having for the past three weeks. The result of the x-ray showed that he had a pneumonia. So I treated the pneumonia, and then before the patient left my clinic, I shared something about Putier Placenta to the father. And the father said, though I'm very happy that you shared with me this Putier Placenta. You know, for the past 32 years of my life, I had been taking care of my only son. And this is the case of my son. He cannot eat by himself. He cannot do anything by himself. I have always to be at his side to see to it that he does what he wants to do. And so he said, this Putier Placenta is very good. But, you know, doctor, I am only a farmer. I cannot afford. So, he left that. That was a Friday. The following day, Saturday, I was so surprised. Why? Because the father came back. And I said, oh, I thought something happened to the patient. And then he said, Doc, when I left your clinic, I prayed so hard. And then something hit my head. I went straight to the bank, and because I am a veteran, I prayed that at least the bank would grant me a loan enough to purchase just even one bottle of Putier Placenta. And your dog, what happened? I said, yes, go. He said, I was given a loan of 150,000. Oh, I am so happy. He was so happy. right then and there, he cut that thick one of pills. He put it right there and said, "Look, here it is. This is a sign that I want to do something for the rest of the life of my son. Because for 32 years, I have been to many neurologists. They have given me medications, and yet nothing happened. So I gave up. I gave up everything for him. Now this is the last chance." So I gave the Putier Placenta, and then, because it will take three weeks to arrive. At least they had to start. After a month, I was so eager to hear from him what happened to him during all the while that he was taking the medicine, the food supplement. And then the father came and he said, with a solemn face, "No, my son could not come here." God, my heart was beating so fast. I thought something happened to him. So, oh, what happened? Then he looked at me. I looked at him. We looked at each other. And then I saw a tear was falling down his cheek. And he said, "Doc, for the first time in my life, I saw my son looking at me straight in the eye. That was the first time." And I said, "Again, ano ba? Some more. He said, "Doc, when I opened the bottle to get the 2 capsules, his hand would extend like that, trying to get the bottle. And now, Doc, he doesn't do like that anymore, but he looks at me straight in the eye, and his hands slowly opening up. Both of the hands. And yesterday, another good news. He texted me and he said, "Doc, for the first time in my life, I saw my son." I said, What? He said, "Doc, he was able to slowly, despacito, raise the hand, so slowly up." I said, "My God, thank you so much, Lord, for this miracle." Because cerebral palsy is so difficult. It is a neurological disorder. It is so difficult to treat. Even neurologists are having difficult time with it. And for that, ladies and gentlemen, it's just a short story, and the story is still unfolding. Thank you so much.